Hello, I'm Donna, the practice manager here at Greater Charlotte Oral Surgery. Our team is honored to be working with you to achieve the oral surgery results that you desire. To ensure optimal results after your surgery, please follow these simple instructions.
If you received sedation, upon arriving home, lie down with your head elevated until the effects of the anesthetic are diminished. On the way home, your driver can get you something cold and soft to eat, like a milkshake. Just remove gauze and spoon in. No straws for the whole week following your procedure. Anesthetic effects vary by individual. Drowsiness may last for a short period of time or for several hours. Plan to rest for the remainder of the day. Do not drive or operate mechanical equipment for 24 hours following surgery. Bite down firmly on the gauze packs for 30 minutes to ensure that any post-operative bleeding stops. Change it out every 30 minutes as needed. Intermittent bleeding, oozing, or pink saliva is often present for several days depending on activity. Repeated gauze pack placement is not required for this. Reposition the gauze packs to ensure that they are exerting pressure over the surgical areas. Sometimes with implant placement, there is also bone grafting involved. If you happen to notice little salt-like particles, this is normal. There will also be a membrane covering the graft under the surgical area. It is important to not disturb the site during the healing process. Do not brush over the area while brushing teeth. Swelling is usually noticeable the morning after surgery, maximizes over the first 72 hours, and may last over a week. Cold compresses or ice packs help to minimize the amount of swelling over the first 48 hours. Warm compresses, such as a heating pad or warm washcloth, help to soothe tenderness and resolve swelling that has accumulated after the first 48 hours. During the first 48 hours, apply a cold compress to the face over the surgical area while awake. Alternate applications 30 minutes on, then 30 minutes off. After 48 hours, apply a warm compress to the swollen areas. Alternate applications 30 minutes on, then 30 minutes off. Hot showers, cheek massages, and jaw stretching exercises will help resolve swelling and limited jaw opening. Prescription pain medication is usually provided to ensure adequate relief of post-operative discomfort. Eat something 15 to 20 minutes prior to taking the medication to reduce the chance of nausea or stomach discomfort. If not contraindicated or allergic to, try taking 600 milligrams of ibuprofen every 4 to 6 hours in addition to the prescribed medication if you continue to have discomfort. If you are experiencing any abnormal side effects or having difficulty staying comfortable, please call our office. Leave the surgical area undisturbed. Do not rinse vigorously or probe the area with any objects. Do not smoke for at least 72 hours. Smoking is very detrimental to healing after implant surgery. Gently brush your teeth as usual. However, steer clear of the surgical sites. Rinse your mouth 2 to 3 times daily after every meal with warm salt water. 1/4 a teaspoon of salt dissolved in an 8-ounce glass of warm water. If you were given a prescription for a mouth rinse, you should use that twice a day in addition to using saltwater rinses during the day. Do not use Listerine, Scope, or any other mouthwash containing high levels of alcohol. Proper nourishment is very important to the healing process. Eating regularly will allow you to feel better, gain strength, have less discomfort, and heal faster. Start with liquids or pureed foods such as ice cream, yogurt, pudding, or soup. Advance to a normal diet as tolerated. Avoid foods like nuts, sunflower seeds, and popcorn that may irritate the surgical sites. Avoid extremely hot foods. Do not drink alcohol for 24 hours after surgery or while taking pain medication. Avoid use of a straw over the first several days to avoid disturbing the grafting and implant site. If you are a diabetic, maintain as normal a diet as possible, monitor your blood sugar, and take your diabetic medication. The first 2 days are generally the most uncomfortable, followed by gradual steady improvement. If you don't see continued improvement or feel like you are getting worse, please call our office. Sutures typically dissolve on their own over the first week. During the healing process, you may be able to see a small portion of the top of the healing abutment or cover screw that is on the implant. This is normal, and it is okay for that part to be exposed. Nausea can occasionally occur after receiving anesthetic medications. Usually, pain medications are the cause, especially if they are taken on an empty stomach. If you become nauseated, limit your intake to clear liquids. Avoid milk products. Sip on some warm soda, such as Coke. Use 600 milligrams of ibuprofen every 4 to 6 hours. Take the Zofran as needed that was prescribed to you. Please call the office if these measures are not helpful.
If you have any additional questions, please call one of our offices. Our staff is happy to help you in any way we can to make your postoperative experience successful. Thank you.